There's such a big fad about different types of diets, right? So there is intermittent fasting. So what's your take on that?
So intermittent fasting, the ideal population to start intermittent fasting will be a pre-diabetic or a diabetic patient. What does intermittent fasting do? So say for example, 8 hours of meal intake and 16 hours of fasting, or even a 6 hours of meal intake and an 18 hours of fasting. So what it does is it gives two things to the body. Like how in a well the water starts seeping if you give it time. So the insulin secretion is adequately loaded in each of the pancreatic beta cells, which can act when we are going to have the meal. That's the first step. The second step, when we are fasting, so what happens is body realizes that we have less glucose in the body. So what it does is it increases the insulin sensitivity of the cells, whereby now the cells which didn't want the insulin to come near them suddenly say, okay, come open our doors, bring all the sugars inside. So that way the insulin sensitivity also increases.
Okay.
So both these dramatically affects in the sugar control of these patients. They think that they can eat whatever they want in the 6 hours. It is not that.
So ultimately, the balance of your diet is primary importance.